The other thing I found relatively shocking from the PNHPD website is that 60% of our health care is already funded by the government here in the United States. And that being the VA, Medicare, and Medicaid. I also like to point out that this is not socialized medicine. Certainly the system that we have in the military and through our veteran system could be considered socialized medicine because the doctors are paid for by the government, and the government more or less runs those hospitals and is responsible for them. The situation at Walter Reed should be embarrassing to us as a nation, and certainly I think single payer would be good for veterans as well. But a single payer system is publicly funded, that means it's taxpayer funded, but it's still privately delivered. And you would have 100% choice in who your doctors are, and your 100% coverage also covers prescription drugs. I like to compare the two systems side by side because we showed how much is wasted. If you look at the $2 bills, 31% under the private insurance plan is what's wasted in our private healthcare system currently in place. If you look at the Medicare, we only use anywhere from 2 to 4% on overhead costs, which is, of course, as Dr. Young pointed out, largely profits in the 31% on the other side. But also look at some of the other comparison, because if you're in a private health insurance system, you have to stay in network. You don't get 100% choice in which doctor you go to. Versus Medicare, the patient should be able to choose both the type of care prescribed by their physician and which physician they go to. Secondly is the claims. Medicare pays all claims, every medically necessary procedures, if we reform it. Claim denials are routine in the healthcare business. In fact, there's a very sad case out in California. Natalie Sarkisian has been the voice of this system, or the voice of the shame of this system, in Cigna Healthcare. She had insurance. 17-year-old woman had health insurance, needed a transplant, and when Cigna denied her the care, and she ended up dying at age 17 because Cigna said no. Even though she had paid her health care, she had good health insurance, and they said no. So even those who have good insurance are at risk in the for-profit healthcare system. But at the end of the day, the question is who's in charge of your health care? Under Medicare, you and your doctor get to make your choices. And under the insurance company tells you who you can go to and what kind of care you can receive. So these are just more points that I like to make as far as what kind of coverage is covered. It would cover preventative care, which is very important in bringing the cost down on health care. It would cover dental care, mental health care, with parity, home health care, long-term care, and all medically necessary procedures. Additionally, one of the last bullet that I'd like to hit on is that you would have to increase reimbursement rates for hospitals. Because currently, as I talked to the CEO of CGH, their Medicare payments are below what the insurance companies are paying, which is why a lot of hospitals don't depend on Medicare. So those reimbursement rates are going to have to go up because the hospital's going to have to pay their bills and be salient at the end of the day. I like to talk about how we're going to pay for it because that's what everybody always asks. First of all, I don't have a slide up here, but if you look at most county municipal governments and how much they pay in healthcare, it's almost 18% of their overhead costs. If you look at most businesses, it goes from anywhere from 13 to 25% of their overhead costs. What we're talking about is having a payroll tax of 7% on the employer. That should say, instead of individuals, it should say on the employer, and a 2% on individuals. And you can see currently what we're paying for both of those. That's in the bracket amount is for Medicare and Medicaid. And then the little diagram shows what we're doing. We're basically just rolling all of these current payment systems into one, which the middle there is your single payer system on the National Health Insurance Fund. We can call it Medicare, we can call it whatever you want. But basically when you get sick, you go to the doctor and it's going to be paid for through the Medicare system. I talked about some of the savings because there will be huge savings. Savings from uncompensated care, of course, and savings from preventative care, people having better and good health. Savings by reducing emergency room visits. But just in administrative costs alone, you're saving 14%, which is $387 billion. So not only are we going to save a little money, we're going to cover everybody in the United States, everybody's going to have access to care. So these are some of the benefits that I just listed. Additionally, there's, I think, some other side benefits that need to be talked about. Half of the bankruptcies in the state of Illinois are a result of our healthcare system. And also, what this will do is allow doctors and nurses to concentrate on what they should be doing, which is providing health care, instead of trying to find ways to pay for the healthcare system. What does this mean for veterans? Veterans always get concerned, and I just like to let veterans know, what we're doing is we're going to make sure that any veteran can go anywhere in the United States that they need. There are some states that don't have Hines Medical Center. There's a lot of places that don't have good veterans health care. For veterans, they should be able to go anywhere in their neighborhood hospital and they would be covered. One of the things I would like to do is convert some of the VA healthcare systems that are currently providing health care and make those into long-term care facilities and to deal with the 20,000 veterans who are currently living homeless in the state of Illinois. We have 20,000 veterans who signed up to serve and defend our country, and because of post-traumatic stress disorder or other mental health conditions, they're living homeless. Eventually, a lot from the Vietnam era. We're going to see a lot more coming back from this war. We are currently losing 1 to 2 soldiers a day in Iraq, but we lose 8. 8 a day commit suicide because they have trouble readjusting in the United States of America, and I think that's wrong. There need to be more outreach programs, and there need to be places for those people to go to get good rehab. And I think that if we had a single-payer system and we open up the doors for our old VA healthcare facilities as places for them to have a nice, safe place to readjust to society, that would be good for our country. Finally, what does it mean for organized labor? We invited some members of organized labor tonight because even unions are saying, well, we've got our health care. They don't understand uncompensated care, and that every year that premiums go up, and the first thing on the negotiating table for organized labor is always health care. I'm a union carpenter, I know, and they say, well, you're going to get a $2 or $3 an hour raise this year, but $2 is going to health care. How do you want to spend the other dollar? Do you want it to go to your pension, or do you want it to go on a paycheck? And it's usually a 50-50 split, but the bottom line is for that $3 an hour raise, most of it's going right back in the pockets of the insurance companies simply to pay for those uninsured population. So it would allow workers to negotiate on wages. It would take healthcare off the bargaining table, and then it would also make us more competitive. It would make small businesses more competitive with other businesses around the world, because we are internationally at a disadvantage because of our healthcare system and the huge cost of this for-profit healthcare. There's some other things that I've talked about and met with people. We talk about medical malpractice rates at the bottom there, perhaps using a public insurance system. We help to cover doctors in med mal cases. I think that over the long haul, as we prepare for the baby boom generation, we're going to have more doctors and nurses and long-term care facility nurses to take care of a growing, aging population in this country, and putting more of those people through healthcare training school and through medical school is going to be to our advantage over the long term. And of course, I'm going from the bottom up, but there has to be an incentive for going and taking advantage of your preventative care, because preventative care is really the key and would also bring down costs significantly if everybody had access and took advantage of their annual checkup. I think that we're going to have single-payer system simply because businesses are getting on board, unions are getting on board, the American people are getting on board. Doctors and nurses who are able to worry about patient care instead of paperwork are going to get on board with this system. But at the end of the day, I think what's going to push us is the Medicare crisis, and that this is the best way to make Medicare solvent is to move to a single-payer system. And when people ask, how are you going to take care of Medicare, I think that Congress is eventually going to be moved by reality on this issue. Certainly, we have a great opportunity here by talking about it, but this is how we're going to have to frame the issue when we get to Washington, and making sure that Medicare is solvent, and then we can move it into a single-payer system. You can elect the carpenter. That's one more step in the right direction. I've said that I'll refuse all contributions from the insurance industry and pharmaceutical lobbyists and pretty much anybody that represents big business. We only take contributions from people. We have one political action committee, the United Auto Workers, has contributed to our campaign, but I'm very selective in both who I apply for endorsements from, who we take money from, but I'm very proud to say that I think we have probably at least 2,000 contributors in this race who have given small dollar amounts, and that's going to make me stay loyal to the American people